Take a moment and imagine one day you're sitting in a chair or walking down the street and you start to feel like your heart is beating out of your chest. You try to take in a deep breath to slow your heart rate however you can because it feels like an elephant is sitting on your chest. Next, you have excruciating pain shooting from your jaw, radiating all the way down to your arm. You suddenly feel nauseated and then you pass out. According to Go Red for Women, cardiovascular disease kills nearly 50,000 African American women annually. 49% of African American women ages 20 and older have heart disease. However, only 36% of African American women know that heart disease is their greatest health risk. Only 58% of African American women are aware of the signs and symptoms of a heart attack. It's frightening to know that African American women have a higher probability to develop heart disease, but over 70% of African American women don't know that this is their greatest health risk or the signs and symptoms of a heart attack. This graph right here shows that African Americans have a higher risk and that women are leading for cardiovascular disease. Cardiovascular disease and heart disease is pretty much, it's the same disease. Today, I'll be talking about the prevalence of heart disease among African American women. Too many African American women are victimized to this disease for so many of our people to be socially unaware. Heart disease has many different forms, but they are all essentially affect the heart or the blood vessels. The type that will be described today is atherosclerosis and how it can lead to stroke or a heart attack. We will also discuss how to decrease the probability of obtaining this disease. Atherosclerosis is a disease of the arteries identified by the formation of plaque created from the buildup of fat and cholesterol. This results in the obstruction of blood flow within the arteries. You can see this within the photo. The one on the left is a healthy artery, while the one on the right is an obstructed one from the buildup of plaque or cholesterol. Symptoms usually aren't presented before the blocked arteries affect blood flow or plaque ruptures. These symptoms could be fatigue, shortness of breath, or pain wherever the affected artery is located. Sometimes you feel sleepy, sometimes you also feel nauseated. Atherosclerosis is a gateway disease that can lead to several other heart diseases, such as a heart attack and a stroke. A heart attack is when the blood flow to the heart is blocked. Without the blood flow, the tissue loses oxygen and dies. A stroke is when blood vessels that carries oxygen and nutrients to the brain is either blocked or clotted. Heart attacks and strokes can develop from atherosclerosis because atherosclerosis obstructs the blood flow, which can eventually lead to either disease. Due to not enough African American women not knowing that they are at risk for a stroke or a heart attack, we will discuss this a little more. African Americans almost have 2 times the risk of a stroke compared to Caucasians and are more likely to die at an early age compared to the other ethnicities, according to Go Red for Women. Those sudden symptoms of a stroke would be numbness or weakness of the face, arm, or leg, especially on one side of the body, confusion, trouble speaking or understanding, trouble seeing in one or both eyes, trouble walking, dizziness, loss of balance or coordination, severe headaches with no known causes. The symptoms of a heart attack are pressure or tightness in the chest or arms, fatigue, heartburn, nausea, cold sweat, and sudden dizziness. Having a high probability for developing a heart disease does not mean you will develop disease. There are multiple ways to prevent and decrease the possibility to develop heart disease. An individual can lower their probability by staying away from red and processed meat, refined carbohydrates, food and beverages with added sugar, sodium, and trans fat, while consistently eating fruits, vegetables, whole grain, nuts, fish, poultry, and vegetable oils. People following this diet have a 31% lower risk of developing heart disease, according to the Harvard T.H. Chan. Also, increasing an individual's activity by being active for 1 hour out of each day while maintaining a healthy weight also decreases their chance. Lastly, they could also stop smoking. Heart disease is a major disease that affects the African American community. After being educated over the basic symptoms, products, and prevention of a type of heart disease, I believe it will help spread awareness and maybe even save someone's life. With this information, we can proactively decrease the probability of developing heart disease and identifying life-threatening diseases before it's too late. Please use this information to uplift the African community to help decrease the dissatisfying statistics involving our community.